Hi guys, welcome back to my YouTube channel. My name is Blessing and I'm about to be your nursing student bestie. Go ahead and click subscribe on my channel because I put out 2 videos weekly breaking down nursing concepts, giving you all the tea, and you do not want to miss any of my videos. On today's video, I heard you guys have been wondering, what is the hierarchy of nursing? How fast can I be a nurse? And I'm here to break it down to you, okay? Get your pen and paper. Let's talk nursing. So first, you want to know that there's something called CNA, which is a certified nursing aide, or some people call it certified nursing assistant. So as the name implies, these are people that actually assist the nurse in the hospital. So they have different roles from a nurse, right? As a CNA, you cannot be given something, like you can't give meds to the patient, like things that have to do with critical thinking. The CNA doesn't do. That is for the registered nurse. Now, what does a CNA do? A CNA might, some of the duties might be checking the vitals of the patient, giving the patient food, helping with daily living activities that they are able to, and then the nurse could also assign some roles to them to assist with that they could do. Okay. How do you become a CNA? You go to school for 4 months. Okay. There are several caregiving courses. In my school, for example, it's called Foundations of Caregiving. Once you do this course for 4 months, you get to write the qualifying exam to become a certified nursing assistant. And if you pass that exam, you could then apply to a job in the hospital. And once you get in, which is really, really good, honestly, because once you get your foot into that hospital, it becomes easier. Say you're in nursing school, for example. Once you're done with nursing school and then you write the NCLEX, the NCLEX is a qualifying exam to make you a registered nurse. Once you write the NCLEX and you become a registered nurse, if you apply for a job and you know the manager, one way or the other, it becomes easier for you to actually get a job in the hospital you worked as a CNA, especially if you're a good CNA. Okay. Okay. Now let's move on. After your CNA, the next one is called an LPN. Okay. Licensed Practical Nurse. So an LPN, in this case, they could help administer drugs under the direction of a registered nurse. They could also help with wound care, help with taking vitals as well. They could also help with food. And you go to school for 1 year, then you write the exam. After the LPN, then you have the RN, which is the registered nurse. Now, some people, I'm going to make a video separately talking about this because this is a bit more intense than what I'm about to give out right now. Okay, so you could go to school for 2 years to become an RN. Now, this is what we call the associate's degree in nursing. So if you go to school for 2 years, once you're done, you get to write the NCLEX and you become a nurse. Now you are in charge of critical thinking, you're in charge of giving meds, you're in charge of diagnosing. That's when you hear something called ADPI. Okay, so you assess the patients, you diagnose the patients, you plan the care for the patients, you implement that plan, and then you evaluate all you've done to the patient to see if you need to do more or if the patient is good. Okay. And after your ADN, you also have the BSN. Now the ADN and the BSN write the same qualifying exam called the NCLEX. Okay. This qualifying exam is what makes the both of them registered nurses. So ADN is like the degree, BSN is the degree. The BSN is a 4-year program. You go to a university for that usually. So for 4 years, then you get your BSN. Or you could do an accelerated bachelor's, maybe 2 years, maybe 1 year, 3 years, depending on the school. Then you get your BSN. Okay. Now the ADN, you go to a college for 2 years and then you get your ADN degree. So your BSN and the ADN, once they both write the NCLEX, they basically have the same duties in the hospital. Okay, now we move on. You have what we call like the APRN, which is the Advanced Practice Registered Nurse. So this is where you have things like NP, which is nurse practitioner. You have things like CRNA, Certified Registered Nurse Anesthetist. You have, doctors of nursing. That's where you start having your PhD and all those things. Now, these people, I think depending on the hospital and depending on which of whatever roles I just called, they get to actually make decisions for the clients or for the patients. Usually, it's the doctor who says, "Oh, okay, this client is sick. I want you to give this client this antibiotics, or I want you to give this client this IV fluid." Now, in this case, they could actually make decisions. A CRNA, I'm going to make a video talking about a CRNA, talking about how much CRNAs earn and all those things. I mean, based on what it says online, though. A CRNA administers anesthesia before surgery, takes care of the patient, almost similar to what an anesthesiologist does. Okay. And then we know about the psychiatric NP. So NPs could actually work in different fields. You could have an NP that specializes in dermatology, one that specializes in psychiatry, different parts, wherever you wish to specialize. Okay, and that brings us to the end of this video. Kindly give me a thumbs up. Comment your preferred field. Are you currently in nursing school? Are you an LPN? Are you a CNA? Like, what are you doing currently? Are you in NP school? Or are you looking to go into CRNA school? What is it you're trying to do? Share with us, okay? Let's know. Like, what are you guys up to? Okay. I'll see you in my next video. Thank you so much for tuning in. Bye.